Respiratory illness is the most common cause of people attending a general practitioner for advice.
Physiotherapy has an essential role in the management of pulmonary rehabilitation, of which exercise training is really the key component.
Breathing re-education is far more powerful than just medication and education alone in quality of life outcomes.
I think physiotherapists are essential in the care of patients, and I would recommend that they are provided to all respiratory patients if possible.
So we need to avoid that paused breath that you sometimes do.
The inclusion of physiotherapy in the management of respiratory illness is now proven to have very positive outcomes for patients.
And out your nose.
There are a number of pieces of research that have been conducted on respiratory physiotherapy. One is in relationship to their effect on people who present with hyperventilation. Another is their influence in people who present with difficult asthma.
Relax your shoulders, nice posture. Physiotherapy brings an extra component of looking at the breathing pattern. So instead of just looking at the respiration in the lungs and the medication and the education of asthma, we look at how someone breathes, and this is vital, absolutely vital. Let the air from the upper chest, keep your posture. Alignment's really important, so sitting up nice and straight, but then just soften your shoulders. We find regularly that when someone has a tip-top breathing pattern, that reliever use is just reduced massively. It can even reduce the strength of doses for preventative medication.
So physiotherapists are complementary to our skills. They have, firstly, time. They're able to educate the patients. They have skills in terms of education of inhalers.
That about 50% of people who are on inhaled therapy for their disorder are actually non-compliant with their therapy.
We reinforce inhaler technique, and in many cases people just do not use their inhaler correctly. We also reinforce what asthma is.
The physiotherapists that we work with have a very high level of knowledge. They're extremely well trained. They have a very good knowledge of general respiratory diseases such as asthma and COPD, and are able to pick up any differences or unusual features that might suggest other diagnoses.
Physiotherapists are excellent with differential diagnosis. This has actually been well documented. We have always got in the back of our minds, is this asthma, or could it potentially be hyperventilation syndrome, vocal cord dysfunction?
How's that feeling?
Pretty good.
We want to make sure that you're working at the right level in order for you to get the maximum change in your health. All right?
Pulmonary rehabilitation combines exercise and education for patients with chronic lung disease. The evidence supporting the efficacy of pulmonary rehabilitation is excellent.
And just relax.
Physiotherapy is integral to improving patients' fitness, and in relationship to pulmonary rehabilitation, there is very, very good evidence now that a well-constructed rehabilitation program leads to substantial improvement in outcomes.
I think the most important thing that I would like to impart is that the role of pulmonary rehabilitation that has level A evidence in terms of clinical trials showing a marked benefit to patients of all respiratory conditions, but particularly patients with COPD and asthma.
Let's just try and increase the resistance a little bit. Patients will notice an increase in muscle strength and endurance, usually during walking, and they will find that they've got increased endurance and will be able to walk further before needing a rest.
It leads to improved perception of control over their condition and over their symptoms, and leads to a reduction in the frequency of flare-ups of their respiratory condition.
Exercise via pulmonary rehabilitation has been shown to reduce levels of anxiety and depression via actually increasing self-confidence and coming into the exercise program and the social interaction it allows.
So the improvements from pulmonary rehabilitation are a reduction in symptoms,